I'm Dr. Ashley Woods here at the Maxwell Clinic in Brentwood, Tennessee, and I am joined today and very grateful for Dr. Brian Hooper, who is I practice this so I wouldn't mess it up, who is a state licensed clinical pastoral therapist. How did I do?
That's right.
All
Exactly.
right. There's a lot of words.
Yeah.
And he is here at the Maxwell Clinic. He sees adults and do you see kids?
Individuals and couples. I don't see children. I will see older teens.
Okay.
Yeah.
Very good.
Mhm.
And his practice is a private practice, and it is not part of the Maxwell Clinic, but it is, it feels like it is, because he's a gift to us by just being here.
It's a gift to me too.
Because he very much integrates into what we do, and we collaborate, we share space, and we share people, and we share I think I can speak for both of us that we share the desire to have people thrive and become the fullest version of themselves.
I think that's very accurate. And I happen to have a real love for a functional medicine approach to psychiatric issues. Even though I'm not a prescriber, it's a real pleasure to be able to work with informed physicians who are able to look at other aspects to help people with emotional distress, using food and exercise and evaluation and their medication when necessary.
Absolutely. Absolutely. And I think it's important to have a team approach. I need to do a little housekeeping here at the beginning, and thank you for joining us. And if you have questions in regards to anything we say today, please put them in the Q&A. Your microphones are muted, so you can't be seen or heard, and this is being recorded, but your questions can be put in the Q&A, and we'll have time to answer those at the very end. So today, our main topic is trauma, and what trauma does to the physiology of the body, and not just the physiology of body, but to the life of the entire human. And when people think of trauma, they think of post-traumatic stress disorder. That's sort of, I would say, probably the most common one, but there are all different types of trauma. And so our goals today are to introduce you to the concept of trauma, big T, little t, and to let people understand how it can affect the body in so many different ways, and subsequently your life, and that it's important to deal with and work through and heal, not just from a psychological standpoint, but from a physical standpoint.
Exactly.
And so
psychospiritual, physical, and social.
Absolutely, because it can affect whole families,
entire
and
families.
communities.
Yep, sure does.
So and it feels like to me that the world is becoming a little, not becoming, but it just feels like since the pandemic, there's just been a lot more trauma that's come to light. And I think we're all affected by lots of things that happen in the world, whether they directly touch us or not. The Covenant school shooting here in Nashville was very impactful, directly, indirectly, to so many people and lives. And so anyway, trauma is really any deeply disturbing experience that you have
that really overwhelms our ability to respond and cope with it. So we all go through stress every day, and stress is not trauma, but all trauma is stressful. And I think that's important to recognize. It's what overwhelms our natural and developed capacity to respond. And the first thing I learned in traumatic stress training was that it's normal to feel abnormal in an abnormal situation. I think that's really important. And one of the things I emphasize is, as we work through trauma, is being kind to ourselves.
Absolutely.
Being empathic, being compassionate with ourselves, that we're not weak because all of a sudden after a traumatic event, out of the blue, we just find ourselves with lots of tears. That's part of our healing, and we need to be able to tolerate and accept that.
Yes, sure. And just giving yourself time and space to do the healing that you need.
Absolutely.
because I think the tendency, what I see, the tendency is for people to intellectualize it, put a story around it, pack it up and stick it in the closet.
Right.
And I have an analogy that once you pack everything up and stick it in the closet and something else happens and you stick it in the closet because you're like, oh, I can't deal with that today, that at some point you're going to need to get in that closet and the boxes will come spilling out. And it'll be a hot mess and you'll feel like a hot mess.
Right.
Because it hasn't been properly worked through or packaged and processed, because the body actually takes on the alarm system.
That's right.
That goes off.
As Dr. Vanderkolk says, the body keeps the score. That's the title of his book.
Mm-hmm.
You know, in fact,
highly recommend that book.
Yeah, the body keeps the score.
Mm-hmm.
We physically experience the trauma not only during it but after the fact as well. But let's go ahead and talk about, you said that there's large trauma with a capital T and small t and different types of trauma. So why don't we talk a little bit about what those type of traumas are? Well,
they can be, a big trauma. People would think about like a war veteran, loss of a child, loss of a parent, a car accident, a shooting. There's so many I can't even imagine. A fire, a flood. Those can be big traumas. Little traumas.
We've had all of those here in Nashville.
We've had all of those in Nashville. Yeah. And people are resilient, but it doesn't mean it doesn't affect you. Right. And, little t trauma would be like, well, I lost my job. Well, that could be a big T trauma if that puts you in a hard financial way, or little traumas that happen every day in your home.
Mm-hmm. Or trauma that I find with people that it wasn't a particular event, but it was the slow drip, 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 drip of behaviors from somebody else, or neglect. Neglect is in childhood, definitely is traumatic. I'm going to mention a few cases as we talk, but whenever I share about this, I'll never share any identifying information, so you'll never be able to guess who any of these people are. Okay. And some of them from my past work with people. But so I have one gentleman I have worked with in the past who his mother was a drug addict. His parents divorced. His father married a new woman, and she decided she didn't want anything to do with him. And he was a little boy, so he was put into a foster home as a child. So he experienced neglect over time, developed some physical symptoms with that, but is exquisitely sensitive to anything he perceives as rejection from his wife today, right? Yeah. So we've had to do a lot of work in two areas, one between them, but also helping him learn to notice the overreaction, right? And how to soothe himself in responding to that. That's part of how he's healing from that drip, drip, drip of rejection in his youth. And I'm sure going into foster care initially was a big T trauma for him.
Yeah, absolutely. Well, I'm glad you mentioned the childhood traumas, because like I said, those boxes that we sort of think we've packed away and have dealt with, childhood traumas are huge. And there was actually a big study done by the CDC and Kaiser Permanente in, I think, 1997. And they were looking at childhood. I know you're familiar with this, but I'm telling our people who are listening. They were looking at childhood traumatic events and health outcomes. And the results were astounding. Not only did they find that people that had more adverse childhood events had, and there's a test you can go online and take, it's called ACEs.
Which stands for Adverse Childhood Events, ACE inventory. Yeah.
Thank you.
And in fact, here at the Maxwell Clinic, you use that as part of your intake forms, and I do too in my work.
We do. And it's important. It's really important because and it's because of what this study showed. The study showed that people had worse health outcomes, more likely to get chronic diseases and to have worse outcomes from those chronic diseases. And actually, the higher the score, the shorter the lifespan in some cases. And this was a big study. I think it was 17,000 people. And there's just so much information out there. Unfortunately, I didn't really learn that much about that in medical school. It wasn't a disease that you could just slap oh, you've got this disease and you can have this medicine for it. And so I think it's very, very much overlooked. And I'm super glad that we pay attention to it here.
I'm glad you said that, because it's not a quote disease we can slap a label on and give a medication to. And that's part of what I love about the Maxwell approach, is that you recognize the whole person approach. And you're not just about giving a pill for an ill, right? Which happens in a lot of physicians' office. Because of the way they're set up, but we won't go into that. But it's not a pill for an ill. It's about unpacking and healing what initially happened in those adverse childhood events. And this is where a lot of the work that I do actually is reparenting people. That doesn't mean I become your parent, but it means I help you do those things for yourself that you should have been taught if you had had really excellent parenting.
And that's a really good, important thing that I wanted to bring up, is that, people feel like maybe they're not weak or they don't have enough resiliency because these things happen to them. And that's not the case at all.
No.
But how it affects your physiology matters immensely, depending on a lot of things. Can you talk a little bit about some of this foundational support that you need? Because you can have two people that went through and lived through the same event, whatever the event was that was traumatic, and somebody, is doing well, and somebody else may not be doing well, and just explaining the difference between the foundations that you need in a community and the support to make a difference there.
So there are, as you're alluding to, external foundations and internal foundations that we rely upon to go through a traumatic event and then to recover from that, right? And so external can be a family that's supportive, a spiritual community that's supportive.
Absolutely.
Okay. Connections in your broader community. In other words, having work that's solid and predictable, right? Having education to be able to understand what's going on, what happened in your life from an educational, academic kind of perspective in some way. Okay. Are you in poverty? Well, that makes it harder. Or are you a person that has some means, and then internal resources. And internal resources. And I want to take just a moment and talk about parenting, if I may, and what happens if it's really good, what we get, okay, and then what happens if we don't. And I'll just take a couple minutes on this. But I want you to imagine, I've got a little guy sitting on my lap. We'll make him about, 5 years old. It's sort of a sweet age, right? So he's happily sitting on grandpa's lap. And he's looking around, he's checking out you, and he's checking out you, and he's looking around the room. And then he notices on the other side of the room, there's a puppy, okay? And he looks at the puppy, and then he looks up at me, and he says, Papa, there's a puppy over there. And I say, yeah, buddy, there's a puppy. Do you want to go see him? And he looks up at me and goes, yeah, I want to go see him. So I put him down on the floor, and I said, go on, go see the puppy. So he toddles over in that direction. He stops part way and he looks back at me because what? He wants to know, is it okay?
He's safe.
He said, and is he safe? Have I got his back? Right? He's not really thinking that. It's all about keeping connection, right? Because right now I've got the strength and he really doesn't. He's only 5, right? So anyway, I said, go on.
It's an unknown.
It's an unknown, right? So I said, go on, go see the puppy. So he plops down next to the dog and he starts petting him the way little kids do, They don't have that smooth coordination necessarily. And, everything's going well until he finds the puppy's tail, right?
Yes.
And he's 5 and he's a boy, so he's going to experiment. Let's see, gives the tail a little tug. he gets nipped at, right?
Mhm.
And immediately what happens? The tears come, right? And he's overwhelmed. Well, I may not be the perfect grandpa, but I'm good enough in the scene. And I leap across the room, and I scoop his little butt up in my arms, and I pull him in tight because I'm rescuing him from danger, but also realize that he's feeling really scared and he needs to feel my strength, right? So I pull him in tight, and I say, as I'm giving him a little hug, I'm saying, it's okay, you're fine. Take a breath, buddy. And I bring him back and I sit him down on my lap. And as he starts to calm down a little, I loosen up.
Mhm.
He's feeling a little bit coming back into his own strength, so I can loosen up a little bit. And I say, it's okay, you're fine. And as he kind of wipes the tears away, I say, hey, buddy, we're not going to pull Puppy's tail again, are we? Because he doesn't like it and you don't like it either. And he goes, no, I'm not going to do that. I said, okay. I say, you know what? I'm really proud of you because you went over and you said hi to Puppy, and you get to do that again. We're just not going to pull the tail next time, okay? And he goes, okay. So I've done 5 things for this boy. I've encouraged him. I've rescued him when he got too close to the danger point. I've soothed or consoled him.
Mhm.
I have lovingly corrected him.
Mhm.
I didn't use
It's
any,
hugely
that's
important.
hugely important. I didn't use derogative language. I didn't tell him he was stupid, anything like that.
Mhm.
And then I celebrated the good part of what he did, which was to go out,
He
right?
was brave. He
Right.
expanded his boundary.
Right. So encourage, rescue, soothe, lovingly correct, and celebrate. If a parent does that for us, then we have much more in the way of internal strength and ability to do what? Rescue ourselves when we go through a trauma, okay? To soothe ourselves, to correct anything that we may have gotten wrong that put us in a danger position. Not that every trauma is your fault. I'm not saying that at all.
Oh, no.
Not saying that at all, but it gives us some skills with which to begin to grapple with that, right?
Absolutely. And I love that story. That's a beautiful story, but we also have patients that or clients that don't have that history.
That's right.
And they have the traumas. And even in my experience, the reason I actually really wanted to bring this up is not because things have gotten a little crazy in the world, but is because I see so many patients that come to the Maxwell Clinic and they have symptoms. We'll talk about symptoms that can relate to stress and such, but they have symptoms and they're real symptoms. They're not in their head. They're 100%. They are real bodily symptoms. And they've been to 12 different doctors, specialists, different clinics, and they're frustrated. They're feeling like they're being told they're crazy.
Right.
They're not crazy. They're people that have real symptoms that don't have a specific label.
And they have psychological effects, right?
Because they have the symptoms that aren't being explained, and that is stressing them out. It's like, well, it's stress. No, it's not stress. I am stressed because I have these symptoms and you would want an answer.
Right. For instance, anxiety could be a symptom that they have, right?
Right.
That, and there's no
thing to feel anxious about.
Right.
Right.
Right. And there's no understanding of where this came from unless they really dig deep.
Right.
Right.
Right. And that's one reason we have our patients on their intake forms do an ACE score. Now, we don't dive right into let's talk about your childhood trauma because I'm not a therapist. That's your hat that you get to wear. But it's important because it's a signal to me about what systems might be upregulated in this person sitting in front of me who is struggling. Because even if a trauma was 30 years ago and they didn't have the grandpa with the puppy in the lap, and you're a really good grandpa, if they didn't have that kind of parenting or that kind of support, and we as parents, I can say this because I'm a parent, I was not always that parent. I was like, what are you doing? Don't pull the tail. There are those instances. You're not going to be a perfect human. I think most of our parents probably did the best they could with what they had.
But that's where we need to learn how to parent ourselves.
Right. We don't
for
have
that.
those skills.
Right.
And then what it does to the body can be a whole litany of things.
Let's talk about that for a moment. So we know that stress, chronic stress, can lead to inflammation.
Absolutely.
Which then in some cases can result in depression, certainly depression, and I think anxiety as well.
Yes, yes.
So that's where it needs to be addressed from a two-pronged approach.
Yes.
One, physiologically, what can we do to bring down the fire in the system, the inflammation, right? And that's your bailiwick, right?
Yes.
And then mine is looking at helping people learn how to acquire the skills that they need in order to care for themselves.
Right.
Because those neural pathways in the brain, neural pathways, I think of like the old-fashioned operator that unplugged the plug here and plugged it in up there and made the connections, they need to be unplugged and rerouted and plugged in another place.
I'm glad you're talking about that because
they go
that
together,
is,
right?
Yes, that's sort of a neuroplasticity because what happens when we go through a trauma, whether it's a drip, drip, drip trauma or a small t or a big trauma, we develop an alarm system goes off in our brain. And it's like the test of the emergency broadcast system or the tornado sirens that go off around here every once in a while. And you're like, oh, what's that noise? And it is a way that is to keep us safe. It's a built-in system that keeps us safe. And it comes from deep structures in the brain, the limbic system. And that's deep structures that involve the amygdala, the hypothalamus, and the hippocampus. Yeah. And those brain structures get sort of wired and ready for action because they also communicate with our hormones. They communicate with our hypothalamic pituitary adrenal axis. It turns on our cortisol. Our muscles tense up. They get ready for action, ready to run. It
fight, flight, or freeze.
Yeah,
right?
That's what the amygdala is. It's the fight, flight, or freeze area of the brain, and that gets turned on. And if it's stuck, like you said, the old telephone systems in that kind of wiring, it has to be rewired. It has to be released from the body. But it's not just the wiring in the brain, it's also the hormones in the body. Cortisol. What does cortisol do? Cortisol is, think adrenaline. So it stimulates, comes from the adrenals, and it stimulates glucose metabolism. So now you got to have glucose for fuel. You got to have energy to run. It turns off the sex hormones. So people say, well, I don't have a sex drive. Well, it's because you're in fight or flight. Your cortisol is up here and it's prioritized from the adrenal standpoint. And it makes your heart beat faster. It makes your blood pressure go up. And all these things in an acute scenario can create a way for you to get out of danger, keep us safe, keep us alive. And that is just an innate in us. We share this with all mammals. But if it lives there, it's very detrimental. And it can lead to... In other words,
if we stay in that stuck state of constantly being
in an emergency.
Yeah.
And so people that are in constant states of stress, as you referenced, will have elevated cortisol levels. They'll have, higher blood pressures, higher heart rate. I mean, there's a lot of things.
Adrenal fatigue.
Fatigue. We see that a lot. And then these have trickle down effects to other things. I mean, I see people who can't sleep because they can't turn their brains off at night. Hypervigilance. Headaches. Migraine headaches, TMJ, low back pain. We kind of harbor we keep our emotions in our hips if you follow yoga.
And some people say it's a sense of being not supported.
Yeah, well, there's a lot of teaching about that. That's old world medicine, but I think there's some truth to it.
I think there's some truth to it too.
And the list is very long. Anxiety, depression. I mean, definitely you think of that when you think of trauma because people are affected psychologically, but heart attacks even. I mean, heart attacks, cardiac strokes, things that make blood pressure go up and can affect those things negatively. It's all related. I'm not saying, oh, this is all because you had trauma in your childhood. No, but it's unhealed system processing that never got to complete the circuit. It's negative energy that got trapped, and you may not be thinking about it. So like, I'm not thinking about my 30-year-old trauma. Oh, I worked with a therapist years ago for that. That's better. I don't think about that. But then when I see patients and they're stuck in the fight or flight, that's a problem.
Absolutely.
That's a problem. And we're not, even if you're eating all the right things and exercising and trying to have good sleep hygiene, it becomes very detrimental. It's like a stone in your shoe. It's just not going away.
Yeah.
And I think the body has to reprocess that in different ways.
It does. And that's where, a combination of cognitive therapy, which is one of the modes that I use, can help us think about how we think about the things we think about and think about those things differently. Right.
Okay. The thinker as the observer.
Right. Begin to notice. I have one young woman I'm working with right now who has suffered with, I'm happy to put that in the past tense, severe OCD and primarily intrusive thoughts, not so much behaviors, but intrusive thoughts, who has come to the point where now she says to me, I'm beginning to notice my thoughts and go, oh, there's one of my, and we use this in sort of the popular sense, are crazy thoughts. I don't mean that in a clinical sense, right?
Sure, absolutely.
But these thoughts that, where do these come from? And we know where they come from now. It comes from some history where there was significant emotional abuse from her father. But she's taking responsibility for her life and learning how to self-soothe and detach from those thoughts. But this is very important to remember, that those neurons that got wired together like the old-fashioned switchboard, fire together, and that didn't happen overnight. There may have been one traumatic event that happened, but it kept being strengthened by replaying
it's like a loop.
Those thoughts, right?
It's like an energy loop.
So it takes a while to begin to unplug those. The example I like to use is, imagine a country road where a circular driveway that's it's a dirt driveway, okay? And you use one part of the driveway to drive up to the house and back out to the road, up to the house and back out to the road. Well, that's going to get worn, right? You're going to even probably get tracks where the tires go.
It's going to wash out.
Yeah, right? The other side is overgrown. But if we stop using one side and started using the other side, eventually the grass would stop growing there, but the grass would start growing where the old pathway was, on the other side of the driveway. So we have to learn how to think differently. We have to learn how to notice feelings and thoughts and accept the feelings, but recognize where they come from so they become less powerful. I want to go back to the alarm system you talked about, the amygdala. And the example I like to use is to imagine you've got a smoke detector and you light the candles for your dining room table. That shouldn't set the smoke detector off, right? And the amygdala, hidden here in the middle of our brain, because this is our brain stem here in my example, and this is the executive function,
which is
the
consciousness,
analytical,
the conscious part,
but
the thinking part.
This part here, the fire alarm, if it's too sensitive, what happens is it cuts off our access to using our rational intellect, right? And that gets in the way of living, because then we do irrational things. Right. So that's part of what happens in the healing process, right? So what do you do? Like, say I have depleted adrenals, this is not a setup actually asking this question. Might you use like ashwagandha to help?
Ashwagandha is fantastic. Yes, there's a lot of different herbs that can really support adrenals, but It's like if you were out on the river and you had a hole in your boat and you'd say, how do I get the water out of the boat? You got to plug the hole first. So you've got to figure out what caused your adrenals to take
to tank
to crash in the first place. And are you still in that situation? And because when people feel completely overwhelmed, they frequently feel powerless. And so giving somebody their power back to be able to take actions. The one thing that I would say is the most important is sleep. Because you're not going to be able to repair your adrenals if you're not sleeping well. And some people can't sleep because.
Can you say why that is? What sleep does?
Oh, sleep does so much.
But I want people to hear this because I know how important it is.
Right. Well, sleep is when your brain self-cleans itself. It's when it resets. So if you ran your computer all the time with a million tabs open and never turned it off, it would get buggy. The brain is the same way. It's where it self-cleans out the debris and lets you store and repackage memories. In fact, talking about those deep structures of the brain in the limbic system, we were talking about the amygdala in that deep section you were talking about. And that part of the brain processes and experiences alert and also emotionally charged memories. The hippocampus stores long-term memories. And when we sleep, that's when a lot of our processing occurs. And you think of REM sleep when we dream. Dreams are frequently very crazy. And I don't know anything about dream analysis. You probably do. But that's when even though the dreams may not make sense or you don't remember or you don't even dream, that sleep, that deep sleep is when you're reprocessing memories. Some people have night terrors because of trauma. Sleep can be a kind of vulnerable place, but you can't sleep unless you feel safe. If you don't feel safe, your sympathetic nervous system is not going to turn off. And feeling safe is important. Now you may say, that's not true. I feel safe in my house. I just can't sleep. There's more going on there on a physiological basis, but it's a reset, and it's almost like a vital sign around here. Sleep is really that important.
And it's when your brain actually, if I understand correctly, produces the neurochemicals, the hormones that we need for bodily repair. Is that right? You
do a lot of self-repair. Yes, absolutely. And so that's why I said if somebody's adrenals are not working well or taxed, sleep is one thing I really hone onto. And then we do sometimes need additional supplements. There's a lot of herbs. Ashwagandha is one, holy basil. There's many that can be very helpful, but it depends on kind of where you are on the curve. And we measure that here at the clinic because it's important, because people can be in that alert state and then over time just drip down to just a flat line. And those people need even sometimes pharmaceutical help to sort of get up out of the hole. Another thing that I think is important that we mention is other ways of processing because you can do cognitive behavioral therapy, like is what you were talking about, giving people some skills and different ways to think about things. But what about other types of therapy specifically that you do? Because you do the hypnotherapy.
I do.
Can you talk about that a little bit?
Sure, absolutely. So the state of hypnosis is a state of altered reality. Okay. And so I use it broadly. So I may do classical hypnosis, which helps people to lower into that twilight state, but also do guided imagery with them. And we can utilize hypnosis to help people reprocess an event that's happened in the past. Okay. And to access resources within that can help them not only reprocess in the past, but live life differently today. So I'll give you an example. One gentleman I'm working with, a very successful entrepreneur, said, you know, I get really anxious when I go to meet new people. Well, this stems from trauma in his past. Okay. So in in hypnotic state, and I have the classical chaise lounge in my office as well, if people want
I have seen that. Yes.
Yeah, but we
It's
can
very
also
comfortable.
sometimes just sitting in the chair, I'll say, just close your eyes and let's try something.
Mhm.
And they gently go into a state of hypnosis then. But but he's, you know, has that trauma in the background, which is part of what brings on the anxiety when he goes to meet somebody new. So we had him access a state of empowerment. What does that feel like in your body? Where do you feel that state of empowerment? And then in his imagination, holding on to that, interacting again in his imagination with meeting a new person. And he said, came back the next week and he said, that was so powerful for me because I was able to access a different state of being, right? And that's also part of how we work through trauma is, and this is very important, we toggle back and forth. So people have sometimes flashbacks, right? Or there may be an event that is triggering for them. So if a person was in a war situation, a loud bang sound may trigger a response that's an echo, right, of the trauma itself. So what we do is help them experientially. So this is not just talk therapy, it's helping them access a state of
A bodily state.
of feeling different as they toggle back and forth between being in that state of calm and holding on to that while they tap back on the other, right? And so we're not asking people to relive the trauma. We're helping them process the trauma by holding on to an internal state of being okay, right? So why is this important? Well, I'm thinking of a woman who I've worked with who was sexually abused as a child, right? And do you think that that could affect her sexual life with her husband today? Absolutely. So helping her distinguish experientially in her body that awful event that happened then from today, and recognizing this right today in this moment, I'm fine. This is a different experience for me than what I experienced as a child with no voice for myself. And that's not just a cognitive thing. We do that using imagination.
Yeah, like guided imagery for re-embodiment of the memory.
Very well said. Thank you, Dr. Wood.
Well, thank you. That's
really well said.
But that is because it is like intellectually we can know, oh yes, that happened, and but the embodiment is just that. It's just it's where you're holding the trauma in your body.
Right.
And most people have no clue about that.
Right.
Because it's a subconscious thing. It's something that is sort of hardwired in there, but we can change it. And those are some tools that you use. I'd like to also mention, and this is not something that I do, but EMDR. EMDR stands for eye movement desensitization
and reprocessing.
And that is what that is doing. And typically you would need to be with a certified EMDR person that does this.
And what it's doing, it's breaking up that cluster we talked about with the telephone operator, right? It's changing the connection, which is also what's happening in the hypnosis work that I do. The same sort of thing.
And it can be done with eye movement, and it can be done with hand movement. It can be done with sound. And it's just a reprocessing, a rewiring, creating new neural networks that helps the body realize, oh, that was a memory. It's not something that I need to worry about now. Now, intellectually, as an adult, you would know that, but experientially in the body, it's different. The body needs to release the trauma. And this is a different journey for everybody. There's certain things that might work for somebody and might not work for somebody else, because we're all individuals.
Right.
It is work. It is work to go through.
Another technique that I use is teaching people to breathe. Now that sounds ridiculous because we
Oh, I
all
do that
breathe
too.
just
I teach
autonomically.
people how to breathe
right?
all the time.
But I teach a process I call it cognitive behavioral mindfulness therapy. And it's the bottom line is this: helping people to attend to their breath so that they can detach from the anxious, provoking thought that they have, or they can detach from some other experience that a stimulus brings up for them, right? I mean, when people have trauma, all sorts of things can trigger them. It can be the sight of something, it can be a smell, it can be a sound, it can be a topic that triggers them.
A look on someone's face.
On somebody's face, exactly. Anything could be a quote trigger that brings back some of the memory of the trauma or the visceral experience of the trauma, really. So if I can help them learn to attend to their breath, then they're creating a neural network such that when it's an unpleasant stimulus, they can and bring themselves back into their own bodies and immediately have comfort, so that they can escape the control of that, otherwise control of that, that provocation, that trigger.
Right. And people frequently, I think, will, when they've had trauma in their life, if they have not worked through it, will reach for other things that are not healthy, like imagery or breathing, for self-soothing. We all do it. I mean, binging on Netflix. You had a bad day, you just want to get home, you have a drink. Gambling.
Anything that can become addictive. Alcohol, sex, gambling, shopping, other things that are exercise. Even as much as I love to exercise daily, if people can overdo, not give themselves time to heal, and it becomes an escape of its own.
And that creates other health problems. And so those are ways of self-soothing or distracting the mind that's busy and unhappy. Not necessarily unhappy, but just sort of running in the same loops in a lot of ways. Another therapy that I'll mention that we have recently added within the last year to our office is IV ketamine, which we've had some remarkable results with people that have had post-traumatic stress, traumatic events, or even just anxiety and depression that has been not well treated with other modalities, and even treated somewhat with other modalities, but they seem to be stuck because it helps with the neuroplasticity. And that's been really beneficial. And we also do brain mapping and neurofeedback here at the office, which a brain map is a quantitative EEG, and you're looking at
tell them what an EEG is real quick?
Well, speaking medical terms, electroencephalograph, I'm not saying the right words, the encephalograph, thank you. And it's like it's a cap that has wires coming out of it, and you're measuring the electrical activity in different lobes of the brain and how it's connected to other parts of the brain.
We can see what's firing, what isn't.
And how efficiently it's firing and how inefficiently it's firing, and which ones are looping too much. Now, we can't look at it and go, oh, there's a history of trauma. Now, we can see if there's a history of head trauma. That's a physical thing.
It's a physical trauma.
A physical thing, but you can see when people are that people are hypervigilant. You can actually see that on an EEG electrically. It's an electrical issue. And then neurofeedback.
I was just going to say, and neurofeedback is an amazing process. I don't do it, but we have a phenomenally skilled clinician here, technician, I should say, that does that. He's quite amazing. And that can dovetail very nicely with talk therapy as well.
So I think the overarching message here is, if you would agree with me, is that we've all had trauma in our lives in different levels, and they affect all of us differently depending on our foundations. the family we grew up in, the community we grew up in, our belief system. There's a lot of layers to that. But it is important that as we work to heal the body, we work to heal the mind and the spirit, because you can't separate those. It's all one. It's all connected. It's just a big system of energy. And if you have negative energy in your body, it needs to be released, because it needs to be worked through, released, reprocessed. And you were talking about breathing. I do breathing with patients frequently, teaching them how to breathe. I know how to breathe. I'm breathing right now. Of course you are. But we all take little shallow breaths all day long because we're busy and we're not focused on it, but really settling and breathing. And some people I have learned have a really hard time sitting and breathing, sitting in the quiet, because they don't like what it has to say.
Right.
And that's hard.
Yeah. If I will say this is a good test. If you can't be alone with yourself without music on or the TV on or other chatter or beyond your scrolling through your phone, if you can't be with yourself for a day, there's something that you need to address. Yeah.
And so I hope that this has been helpful to folks. I do see we have some Q&As here.
Super.
So I'm going to click on that. Hold on one second, if I can find my cursor.
There you go.
We go.
Yeah.
Okay. All right. Can you discuss resources, neurofeedback, etc., that are used to assist in helping individuals rewire their brain and amygdala, in addition to working with improving conscious thought patterns in an effort to help that individual move out of a constant state of hypervigilance? Yeah, I think we kind of touched on that sort of towards the end there, but we here at the Maxwell Clinic pair all of those things together. We use neurofeedback, we use as far as the electrical brain retraining, and we consider that sort of the spark, and then we work on the soup. We work on the soup of the person, in that we maximize sleep, nutrition,
So you see what's going on with them biochemically, is that what you're saying?
You have to
That's
do
what
that.
you mean by soup?
You have to do that, the soup, the biochemical parts of it.
Yeah.
Dr. Hasse likes to refer to it as spark and soup, but the spark is the neurofeedback part. And there is some retraining there. The breath work, that's working on increasing vagal tone. We didn't talk about the vagus nerve much, but I will mention it briefly here. The vagus nerve starts in the deep brainstem and runs all the way down through the diaphragm. It innervates the diaphragm, which is the big muscle that keeps us breathing. If the vagus nerve is cut, you're done for. You can't breathe, because that's what pumps the lungs up and down. And to exercise the vagal nerve, I have people take a really deep, nice, long breath.
And when we let it, I find when we let it out slowly and instruct people to experience the sense of release that comes as they exhale slowly, that immediately brings down the anxiety, calms heart rate.
It does.
Lowers blood pressure, I believe.
Yes. And it's a practice. It's a practice, because in the moment, you can take a deep breath and a sigh, but if you practice 10 minutes, I tell my patients to practice 10 minutes of deep, slow, meditative breathing, like bookends on the day, 10 minutes in the morning and 10 minutes before bed. And it really sets the intention for the day and helps pack it up for the evening. But what that diaphragm expansion does, in addition to helping you take a deeper breath, it just sort of sends little neurochemicals up to your brain, because the vagus nerve was stretched, and it's just like, oh, we must be relaxing now. This is good.
Because you can't stay in a fight or flight state and be relaxed at the same time.
Right. And you have to practice that. It's a practice. And I tell people, don't be making your grocery list while you've got 10 minutes on your phone. Just set it aside, set a timer, and do that. So those are the things. The second question is, what if you're really sure what if you're not really sure where you are in regards to processing trauma? I'll let you take this one.
Yeah, I think in that case, make an appointment with a psychotherapist that you trust, and have a conversation about what feels like it's not quite healed for you, perhaps, and what is healed, and bring the uncertainties out and just discuss them. Have an evaluation, see where you are.
Yeah, I have a lot of people that come with physical symptoms and they don't come talking about trauma. That comes up much later, after we've made sure we've crossed all the T's and dotted all the I's and made sure everything is tucked in. Another question we have is another unrelated question, the microbiome in the gut. Thank you for person who is asking this question, because that is important. Seems to be getting more and more attention as having a profound impact on the state of our bodies, nervous system, and brain. Can you discuss this and how an unhealthy gut microbiome impacts the overall healthy process? Yes. We could just keep going for hours here, but this is an important question. If your gut is not healthy, your brain is not healthy, because the gut microbiome, we are learning more and more through science about what a big role it plays in our overall mental and physical health. And I think the more research we do, the more we know. I mean, I think
if I understand correctly from the fellowship year I did in integrative psychiatry, that the gut produces the neurochemicals the brain needs in order for us to feel good and balanced.
Most people think that serotonin and norepinephrine are only produced in the brain. Actually, it's produced in the gut.
Yeah. And the gut sends more information to the brain than the brain does to the gut.
I know.
Right?
Yes.
Yeah.
So,
amazing.
We usually start with some gut work.
So great, Corbin. That's a great question.
That's a great question.
Yeah.
Yes. Okay.
I love it.
Last question here is
a long one.
It's a long one. So, and I'm sorry, I should have had my readers on. Dr. Wiz and Dr. Cooper, thank you so much for generosity with this webinar. What you were saying makes so much sense. I am recovering from a TBI and an accident for 3 years, and a trauma that unknowingly got packed into a closet has been spilling out while I have worked hard weekly in different therapies to physically heal. After these years, I understand that the roadblocks in recovering from the undealt with trauma in the brain and the mind and body disconnection. Some pain, much of what you have talked about already, continues frozen in the body despite the work with PT and OT, vision therapy, and cognitive behavioral therapy. What you have said about the amygdala makes so much sense. How can you turn the emergency signaling off and get the mind and body working together, not triggering each other? I am sorry if I missed it. You have packed so much excellence and facts in this short time. Do you work with patients outside of Tennessee? Okay, this is sort of a long question, but I am so glad that you asked this question. A TBI, which stands for a traumatic brain injury, can cause your gut to be leaky. In addition to all the other things that can come with a traumatic injury. And I think your question embedded in here is, what do you do to turn off the emergency signal? And that's sort of what we've been talking about. Hypnotherapy, the EMDR, there's also brain spotting, which is very similar to EMDR. We don't specifically do that here. There are other types of therapy that are somatic sensing therapy, and doing really good work, exercising the vagal nerve with breath work, guided imagery, working with a good therapist, doing good cognitive behavioral work. I think we're at time now, and if you have questions that we weren't able to get to, please reach out to us. I'd like to be able to continue to answer your questions if possible. Or if you're interested in becoming a patient at the Maxwell Clinic, go to www.maxwellclinic.com, or if you'd like to reach Dr. Brian Hooper, I'll let you share your information.
Yeah, the best way to reach me is through my website, and the website is www.drbrian, Brian, Hooper, Hooper, drbrianhooper.com. And there are forms there you can just fill out. It's like an email form. Send me that, or you can call my phone number directly. It's on there as well.
So
Okay.
I just want to take a moment and thank you so much for
Thank you, Dr.
spending
Woods.
time with me today.
It's fun.
This was fun to talk
It's
about.
fun.
And it's important.
It is important.
It's
Thank
really
you.
important. So reach out if you would like more information, and have a blessed day.
Bye-bye.
Bye.